Hi dear students, in this special series on subject-wise strategy, we are going to identify all the important topics that you must keep in mind before you start working on a subject. We'll be looking at the trend for each subject and then mapping it to all the tasks in the app so that you can prepare better and score better. In this video, we are going to look at the strategy for oral path and oral medicine. Now, oral path is like wolf in sheep's clothing. It looks very, easy going, but it can be very aggressive if you are not tackling it correctly. There is a lot of overlap of oral path with almost all the specialties of dentistry. So more or less, you are going to end up studying a lot of parallel topics when you are preparing oral path. Now, the trend for oral path has been consistently on the high, and on an average, you can expect 30 questions per exam, right? So in the last exam, 33 questions have been noted. Now, for the sake of clarity and for the ease of simplifying the whole process, we have all the topics on the left side, as you can see, and we have nearly 200 past questions from NEET MDS on the right side. Now, in order to understand which topics are more important, we will look at the strategy. We'll see which questions fall into which topics and then identify the frequently asked topics, and then we'll prepare them accordingly. Now, before we start overviewing these questions, let's take a look at the topics on the left and understand what all parallel subjects you must also focus on when you are preparing for OPATH. So, developmental disturbances is individually on its own important. Then precancerous and benign malignant lesions, they are also going to overlap with oral surgery. That is also the case with tumors and cysts. Salivary glands, the anatomy, the physiology, that is DA, and also in anatomy, the embryogenesis, then diseases over here, and also the treatment in oral surgery. Dental caries, pulpal and periapical infections in cons and endo, also in pediatric dentistry. Then physical, chemical injuries and all the systemic problems you have to correlate with patho and medicine. Then diseases that include then infections like bacteria, viral, fungal, you have to correlate with microbiology and also the syndromes. So there is a whole lot of parallel topics in oral path. Now let's start assigning these questions one by one and see what's important. So the first question is on Turner's hypoplasia, which is a form of enamel hypoplasia. Here an 8-year-old child is reporting with brownish discoloration. So this is developmental disorder. Then we have the photomicrograph of sickle cell anemia. Then here there is aplastic anemia and a case-based question with a patient with malaise and generalized weakness. So that's diseases of blood. Then again diseases of blood, agranulocytosis. There is a clinical situation, WBC count is given, and there is severe neutropenia. As you can see, there are a lot of questions from the same topic in the same exam. That means in 2023, diseases of blood was very popular. Right, then Hurler's syndrome you will also see in biochemistry, mucopolysaccharidosis, right, increased mucopolysaccharides. Then in a patient with unilateral swelling on the left parotid, this is salivary gland, pleomorphic adenoma. They have also given all the microscopic features. Pleomorphic adenoma in itself very popular as an exam topic. Then we have a child with fever, cough and throat pain who is suffering from diphtheria. So this is a case-based question, bacterial infection. You could also classify this question in micro. Then we have a clinical image of audacious granules, that's developmental disturbances. Then we have a female with herpes, clinical image, viral infections. Then a fair-skinned female presents with warty growths on skin and face, and there are these clinical well-defined form sessile ulcers on lower lip, which are examples which are presentation of keratoacanthoma, a benign tumor. Patient presented with unilateral facial atrophy and Peri-Romberg syndrome. Fournier's molars, very popular, congenital syphilis, bacterial infections. Then pustules are initially oral lesions in in pemphigus vegetans, skin disorders. Oral hairy leukoplakia is caused by Epstein-Barr virus. Kuttner's tumor, submandibular gland. So this is another salivary gland pathology. AOT has hyaline ring. So that's odontogenic tumors. Then nodular type of malignant melanoma shows vertical growth phase. Malignant tumors. Oncocytes are seen in aging salivary gland in oxyphilic adenoma. Right, then a female has multiple organ failure and a rash on the face across the bridge. So this is the butterfly rash, popular in SLE. Not a feature of Down syndrome. Features of Down syndrome, very important. So syndromes. So here the skull radiograph revealed hair on end appearance. So this is thalassemia. Again, diseases of blood, deletion of beta chains. Then you have an image-based, case-based question on malignant melanoma. Now this is one thing about OPATH that you will see a lot of case-based and radiographs, image-based questions with regards to all these anomalies. So whatever you are reading, you must also apply. So you must have a very visual understanding of what you are preparing. Right, then excretory duct tumor, salivary gland pathology. Then this is an image-based question of Treacher-Collins syndrome. We'll classify that in syndromes. Then here we have a radiograph, skull radiograph and OPG and all the description of jaw cysts. So that's jaw cyst basal nevus syndrome. Then a patient reported to the clinic with raised edges, no further symptoms. That's basal cell carcinoma. Let's assign it to malignant tumors. Then we have a patient with swelling on the upper lip on both sides. And the answer is nasolabial cyst. So that's cysts. The topic is cysts. Then a case-based question again with fractures in femur, radiology showing loss of lamina dura, hyperparathyroidism. That's metabolic disease. Then actinomyces, that's bacterial infection. Residual cysts will show Rushton bodies. So that's chapter on cyst. Sharp lancinating pain, trigeminal neuralgia. Very popular questions on trigeminal neuralgia, almost always there in NEET MDS exams. Then a clinical image and a big history of a patient suffering from sialadenosis, which is a salivary gland pathology. Then radiographic identification of Talon's cusp, right? Then we have osteomalacia and clinical features. Which of the following precancerous lesion? Now we have a precancerous lesion, erythroplakia, which has the highest malignant potential. So as you can see, precancerous is blinking here. Then we have a question from forensic odontology. And this is type 2 lip print by Shushi Hashi. Very interesting name. All of the following are causes of intrinsic discoloration. So discoloration is oral pigmentation over here. Next, supernumerary tooth. So that's developmental disturbances. Then we have dentigerous cyst. So that is cyst. Then we have a radiograph of mesiodens. Then we have an OPG. Again, this is a repeat of jaw cyst nevus syndrome. Now we have a clinical picture of homogeneous leukoplakia. At any point of time, if you think that this question is difficult or if you want to know more about it, always feel free to look at the explanation, okay? So the explanation will tell you all the information that you need regarding that specific topic. A lot of explanations will also show you how to eliminate topics or why the other options are incorrect. You can look at the key concept. Plus, you can always watch the video explanations. The video explanations will have a lot of parallel knowledge, a lot of interesting images from all standard textbooks. So do not miss out on these very specific questions which have a lot of image-based question possibility. Look at the MCQ videos without fail. Right, then the next question is identify the probable non-scrapable white lesion and the treatment. That would be leukoplakia, pre-malignant, pre-cancerous conditions. During reconstructive identification, how do you differentiate between teeth? So that is forensic odontology and also on tooth development. This question can also fit in dental anatomy. Certain common characteristics help us differentiate from one teeth from other. Which of the following tooth does not resemble any tooth? Again, forensic odontology or DA or development. 14-year-old patient with complaint of mobile teeth, and then gene analysis involves cathepsin C gene. This is Papillon-Lefevre syndrome, also relevant in perio perspective. We'll classify here in disease of blood, or we can also classify it under syndromes. So you will see there is a lot of overlap of one question. It can fall into a lot of topics. Now this is erythema multiforme minor, and there is a clinical image. Ameloblastoma, histology, the pathogenesis, all important. It starts from dental lamina. So that's an odontogenic tumor. Then we have a clinical image of squamous cell carcinoma, right? And how do we arrive to this diagnosis? Always look at the explanation, take down notes from the explanation without fail, watch the video as I told you. Then the next question is on Ewing sarcoma, where the patient has swelling in femur and gives history of trauma in the same area, rupture of periosteum. So all these keywords are important whenever you are solving long case-based question. Always start reading the last line of a long question, then it's very easy as to what you are looking for, right? Then the next question is on tissue processing. Clearing agent used in histopath is xylene. We could have also classified this question in pathology. Hereditary enamel hypoplasia is seen in all deciduous and permanent teeth. The distribution of enamel hypoplasia. Then we have Kaposi's sarcoma, and the causative agent is herpes 8, viral infections. Floating tooth seen in Langerhans histiocytosis. Features of cyanocobalamin deficiency. Then a patient with fever, photosensitivity, and nasolabial rash. Identify SLE, this is the butterfly rash, right? Then a 36-year-old female, male complains of swelling on the right side of the face. And then there is a whole big story. The best diagnosis would be. So this is a case of pleomorphic adenoma. This is like the 5th time that we've seen pleomorphic adenoma in a clinical and a case-based question so far. Herringbone pattern, histopathologically seen in fibrosarcoma, malignant tumor. Then we have this very popular image of Eppert syndrome. If you've gone through the notes, if you've gone through explanations, you'll find these images over and over again. So new images will also be seen. But most of the time when you are seeing case-based clinical questions, the images will be very identical to what you've seen in the app. Then osteomyelitis, the suppurative word refers to involvement of medullary bone. So that's pulp and periapical. Then a question on demeridian method of staging tooth with regards to forensic odontology, one of the most popular methods in NEET MDS questions. Suprabasilar and intraepithelial split pemphigus, classic question. Patient with pain in tonsil experiences this due to glossopharyngeal neuralgia nerve. Okay, then here we have osteoid osteoma on radiographs. as you can see here, right? Then which of the following is associated with 3 H's? Hypovascularity, hypoxia and hypocellularity. It's osteoradionecrosis. Okay. Then a 45-year-old female complains of tiredness, fatigue, koilonychia. This is a case of Plummer-Vinson syndrome. Then this is a classical picture of malignant melanoma, which has the vertical growth phase as well. Then identify the anomaly given in the radiograph. This tooth has dense invaginatus, developmental anomalies of teeth. Then a question on Benz-Jones proteins. OPATH is incomplete if you have not practiced this. Multiple myeloma. Next question, radiographic diagnosis of a neuroma. A patient present with history of hypercalcemia. Okay, so that's hyperparathyroidism, metabolic diseases. Then we have a calcification following trauma, that's traumatic myositis ossificans. Patient with history of trauma a few years ago and progressively restricted mouth opening. So I hope you are following the whole pattern as I am assigning these questions to their specific topics. They'll blink, right? So you'll be able to see the changes in the number. Then a cephalogram, lateral ceph, and a lot of features corresponding to Crouzon syndrome. Crouzon syndrome is important, right? You can go through the clinical features and also go through the video. The video will also have a lot of good illustrations and more facts regarding that condition. It will help you solve the question by eliminating options, and it will also add a lot of new concepts to your preparation. So these are the different radiographic appearances that are given in the option. So make sure that you watch all these videos whenever they are available. Okay. Then the next question is on AOT. It's a 2/3 tumor, anterior maxilla, female, canine, all 2/3. See? So that's odontogenic tumors. Then keratocystic odontogenic tumor, and the swelling is expanding in a specific way. Then a clinical question on cherubism. More or less clinical questions in OPATH. Case-based questions. Most common tumor of salivary gland is definitely pleomorphic adenoma. Then we have OKC, and what is the most concerning factor? It has high recurrence rate. Right, then Paget's disease, generalized hypercementosis, protrusion of upper anterior teeth, incompetency of lip. So that's bone. Another bone question on fibrous dysplasia, increased levels of alkaline phosphatase and bilateral expansion. 10-year-old child, look for the age group without fail. Next question, direct immunofluorescence showing IgG against hemidesmosomes, that's bullous pemphigoid. Skin lesions. Then diagnosis of leukoedema. Then diagnosis of erosive lichen planus showing white radiating lesions, sawtooth, retapex. What else do you want? So all these specific features pertaining to each lesion, these are must knows. Okay, now that's a very classic clinical radiographic appearance of an odontome. So that's a compound odontoma, developmental disturbances and odontogenic tumors. Okay, now this is hair on end appearance, thalassemia. What next? We have a cytological smear showing distribution of swelling on the hard palate, and it's nevus. You can see the cells. Altered neural crest cells are proposed in the etiology of mandibulofacial dysostosis. This is herpetic stomatitis. Just by looking at it, you can say. That's a clinical image of a mesiodense. Right, now this question, patient presented with a lesion on the buccal mucosa with T1 staging, what should be the treatment? That is important, okay? TNM staging is something that usually students will ignore, and this has to be properly understood. So look at all the TNM staging notes and make sure that you are answering this correctly. Identify the lesion. Now that's alveolar cyst of newborn, and it's very easy to confuse with the other options given. Make sure you read the explanation here and go through the video. Lesion on the posterior slope of hard palate shows perineural invasion. That's PLGA. Salivary glands. Okay, then you have this patient with difficulty in mouth opening. You can see they have pointed the arrows on the stylohyoid. This is calcification of the ligament, and that's Eagle's syndrome. Then we have a patient with multiple draining sinuses and a woody jaw, that is actinomycosis. The word woody is very popularly used with actinomycosis. And a 10-year-old with lesions along the tonsillar pillar and soft palate and vesicles, fever and pain, that's herpangina. Easy to confuse with diphtheria. Then a 45-year-old patient presents with dilatation distal to the arch of aorta, mitral valve prolapse. This is all features of Marfan syndrome right away. Okay. So we'll put that under syndromes or bone and joints. Steps in dental profiling, that's forensic odontology. Then a patient presented with multiple cysts, Fox cerebri, bifid, golden goals. We've seen this question before, right? Identify the condition. Here the patient is 4-year-old, mobile teeth and exfoliated anterior teeth. He's suffering from hypophosphatasia. Specific feature of Horner's syndrome. So all three except one. Then patient presenting with yellow-brown discoloration of teeth, and the mother gives a history of treatment at the age of 2 years. So teratogenic nature of tetracyclines. Chemical injury. Then we have hepatosplenomegaly in a 55-year-old patient and Hodgkin's lymphoma because the cervical and inguinal nodes are progressively swelling. Then a radiograph, OPG, with buccal and lingual cortical plate expansion is peculiar to OKC. You can also see the soap bubble appearance. Also the area where the radiolucencies are. You have to keep an eye on all these small features. How the radiolucency looks, what is the area that it is presenting in, and whatever the history is given. Also look at the number of teeth. Look at whether they are completely erupted or impacted. That will give you a lot of information for syndromes. Right, then we have a pedigree chart for achondroplasia. A lot of students find it difficult to understand pedigree charts. Look at the explanation, understand how it is explained in the video. For example, in this particular video, all features of pedigree charts are explained. So you can definitely watch this video and understand pedigree charts. Okay, next question is peripheral giant cell granuloma clinical image. And the next question is vitamin supplementation that is used for management of recurrent oral ulcers. B12 is used. And a question of unilateral cleft lip, embryology. Then again a question on hypophosphatasia. The same patient, clinical image is provided. Earlier the description was provided, right? Incomplete root formation. Then physical injuries and regressive changes, effraction, right? Which of the following is associated with HHV8? Kaposi sarcoma, that is viral infections. Most commonly associated with HPV, viral infections. Pregnant lady consuming alcohol in the first trimester, fetal alcohol syndrome, diagnosis of infectious mononucleosis. Epstein-Barr virus is the etiology, so viral infections. Crest syndrome includes all of the following except, so that's bone and joints. Then Rader's syndrome, nerves and muscles. Ramsay-Hunt syndrome, clinical features, patient reporting with specific features. Xerostomia can be caused during all of the conditions except salivary glands. Identify the image. This is gingival overgrowth. We can also put this question under perio. Greenspan lesion is hairy leukoplakia. And a patient with Ramsay-Hunt syndrome and all the other features. This is a second question in the same paper on Ramsay-Hunt syndrome. Preauricular swelling and pleomorphic adenoma, the sixth time that we've seen this question. Again, pleomorphic adenoma, most commonly seen in parotid gland. So in the same exam, multiple questions on pleomorphic adenoma. Then we have features, unilateral restricted movement of soft palate, pain in jaw, nasopharynx tongue, Hall-Trotter's syndrome. Common site for malignancy in mandible is the molar area. Factual question. Then elevation or bilateral ear lobule due to swelling which is increasing in size. This is viral infection. It is because of mumps. Then a clinical image of Warthin's tumor. You must have seen this man in practice questions before. 23-year-old female showing herpes labialis, clinical image. So we'll put that in viral. This is Kaposi's sarcoma. This is the fourth question on Kaposi's sarcoma. Again, Demerijan method, forensic odontology, second question. NEET MDS 2020 was very high on Demerijan. Again, we have a question on Demerijan. So you will have to see the questions, okay? Method of age estimation here, and here forensic odontologist studies 7 mandibular posterior teeth. So look at the explained questions first. Don't be in a hurry, right? And look at the explanation. Try to understand what they are trying to ask. Correlate. You will find 5 other questions in the same explanation. Look at that first, okay? Then another question on forensic odontology, right? Then technetium 99 MDP scan of a young male smoker, hotspots bilaterally parotid, that is Warthin's for sure. Then another CT image of Cruzon syndrome, second time CT image. 8q12 gene, the locus is popular for pleomorphic adenoma. That's salivary glands. Then in granular cell type ameloblastoma, so that's odontogenic tumor. What are you going to see in the granules? So we have lysozyme aggregates. Then a specimen containing periapical mass of an extracted tooth is showing capillaries and inflammatory cells. It is most likely to be a periapical granuloma. So we'll classify that under pulp and periapical infections. Then a restored tooth with a class 5 composite restoration is having a small mass near its cervical part. And there is keratinization of squamous cells. This is SOT. And the histology. Then the next question is a histology section of extracted tooth showing granulation tissue after long caries. There are Russell bodies. So we'll put that under pulp and periapical. First question on caries, Stephen's curve. Now, of course, caries will be discussed under cons, pedo, multiple places. So don't be surprised if there are less questions here because you will find those questions in other subjects. Then CBFA1 gene is associated with cleidocranial dysplasia, bone and joints. Alarm clock headache, very typical questions, phenopalatine neuralgia. Then risk of bleeding, spontaneous bleeding occurs when the platelet levels are below 10,000. So that's blood disorders. You can also find this question in patho, physio, oral surgery, anywhere. Which of these is a type of scleroderma, Peri-Romberg syndrome? Diagnostic modality used for assessing pathology of major salivary gland, you use FNAC very popularly. Salivary gland, lot of questions. Then discomfort, pain and swelling on salivary gland, again salivary gland, that is calculus. Floating teeth, second time, so it's repeating in 3 years, histiocytosis. Reaction to cosmetic fillers, most commonly seen in oral cavities by nodule formation, very popular amongst youngsters. All of the following are strongly associated with AIDS except AIDS important, okay, in any case with perio, medicine, pathology, microbiology, opath, AIDS is important. Common oral infection in AIDS is candidiasis, no doubt. The next is Greenspan lesion, which is again hairy leukoplakia. So that's disturbance of teeth, jaw, tongue. Heart-shaped radiolucency, very commonly asked. Nasopalatine duct cyst. Okay, which of the following has the highest premalignant potential? Dentigerous cyst, again belongs to cyst. Then cyst which is attached to apical foramen of tooth is a pocket cyst. So as you can see in 2019, so many questions appeared from cyst. The reason why I'm telling you this again and again is don't think that because you have left one topic, it's only going to be 1 or 2 questions that you will miss out. It could be that in that particular year, many questions may appear from one topic, right? Then which is a pseudocyst or not a true cyst or traumatic cyst. Then with age, which cells increase in number in salivary glands? Oncocytes, this is a repeat. Then next is phoenix abscess, that is chronic periapical abscess exacerbation, which is a pulpal question. Then a 40-year-old female with pain in right cheek, and this is related to trigeminal neuralgia. Yet another trigeminal neuralgia question. Then Morphea form of basal cell carcinoma, malignant tumor. Then pityriasis rosea, skin lesions. So here all the clinical features, Herald sign, don't forget that. Which suture closes first in Cruzon syndrome? The coronal suture, right? Don't forget to check out the explanation. Right, next. Hypoplasia of parotid gland is seen in hemifacial microsomia. That's development and syndromes. Ossifying fibroma, true and false statements. True, so the false statement is abnormal bone of lesion blends with the adjacent normal bone. However, there is a demarcation in this case. Which of the following is not a feature of hyperparathyroidism? Osteopetrosis. Leontiasis osseosa, Paget's disease of bone. Marker for proliferation. Now, one of the very few questions on molecular pathology. Right, so this is precancerous lesion again. Fothergill's disease is trigeminal neuralgia. Drug for candidiasis, fluconazole. Mycotic infections. Most premalignant lesion with the potential to convert into cancer is erythroplakia, of course. Okay. Then which index correlates? T-Merijan index again. This question's ever repeating. Cherry red macules on skin is hereditary hemorrhagic telangiectasia, skin lesion. Now this is a classical picture of epulis fissuratum. I would also put this in prosto, but it's okay. Then most common organism responsible for denture stomatitis, again a prosto-opath overlapping question. So mycotic, usually candida related questions are most popular. Then which of these is used to assess the possibility of dysplasia? DNA ploidy. Then next is ground glass appearance in hyperparathyroidism, metabolic disease, pseudocyst, again traumatic cyst, this is a repeat question, back to back in 2 years. Then true or false about hypophosphatasia. So true question, true is decreased serum levels of alkaline phosphatase, multiple draining sinuses. Third question from actinomycosis so far. Natal and neonatal teeth are not associated with Down syndrome. Typical type of scleroderma, Perry-Romberg, again a repeat question with a different sentence structure. Perioral freckles are seen in Peutz-Jeghers. Remember all the other features, especially intestinal polyposis. Giant cell tumor is similar to granuloma in all of the following except. So giant cell lesions are tumors of bone. Then features of TUCSI, that is traumatic ulcerative granuloma with stromal eosinophilia. Which of these is used to check vitality of cells? So tryptin blue, I would also put this under pathology. Lacrimation is seen on mastication. This is because of facial nerve involvement. So disease of nerves. Another question on trigeminal neuralgia, which is a case-based question. Increased salivation or tylism is seen in mental retardation. Which of the following anomaly needs consideration in restorative treatment? Because dense indent is complex, so endo is difficult. Achondroplasia is caused by FGFR3 gene. Most common tumor of salivary gland, pleomorphic adenoma, third time repeat. Acrodermatitis enteropathica is a multi-organ failure due to zinc. First time. Which is the most common manifestation of herpes simplex infection? Recurrent herpes labialis. 40-year-old patient with necrotizing cyalometaplasia. Clinical question. Look at the history carefully, especially the hard palate. The site is important. Osteogenesis imperfecta occurs due to collagen problems, so bone and joints. And then submandibular sialadenitis, patient complains of swelling and pain on eating food, right? In case having multiple caries, peripheral neuropathy and salivary gland aplasia. So this is Sjogren's syndrome. You will check NT-ROLA. Best method to diagnose non-odontogenic pain is procedure. This is also an endo-resto question. Radiographic appearance of hypophosphatasia is shell teeth. Also remember where else you see shell teeth. Main reason why amylographics is not recommended in forensic odontology. So this is a forensic question. And lastly, dentin translucency as a factor of age estimation was not used by, again, this is a forensic question. Now let's look at the summary of what we have achieved, and this is pretty surprising that salivary gland tumors and pathologies, which is such a small topic, had so many questions in the past NEET MDS exams. So this one topic is definitely important. Syndromes is difficult as a topic because there are too many syndromes and too much information, right from their etiopathogenesis, their genetics, to remember each of their features, to remember how to identify based on clinical presentation. But one very peculiar thing that can help you with syndromes is look at the MCQ videos when you are preparing, because there are so many images which are included in these videos that you will have a pictorial memory of all different kind of photographs that are picked from different sources. So syndromes have to be prepared very well with videos. Okay, so MCQ videos, when they are attached, make sure you watch them. Then other questions on bone and joints and cysts and tumors are also very popular. There is nothing that you can possibly leave in OPATH, but I really want to highlight the fact that repeated questions have appeared in forensic odontology over the past few years, and that is one topic that you've not really focused as undergrad. So you must revise that, like pay more attention to forensic odontology because it's less information and more weightage. Then bacterial, fungal and viral infections, very easy and parallel to microbiology, so it will always get covered here or there. Pulp and periapical infections will also get covered elsewhere in endo, so you don't need to really worry about that so much. Caries surprisingly is less here because we've covered more of caries in pedo and restorative, so you can always expect the overlap. And overall developmental disturbances is important. You cannot skip that. Look at all the images, the x-rays. Now another way of tackling a lot of these anomalies is to look at the radiographic appearances. So we have a lot of radiographic diagnosis related questions in oral radiology. Make sure you are watching that video and the strategy and the related questions and content with regards to oral radiology. Now how do we transmit this to our preparation strategy? It's very simple. You don't have to do anything much. Everything is already categorized as tasks with specific topics, and it's very easy to go through them. For example, if you want to prepare cysts and tumors, you will have access to the notes, that is bytes and workbook. I would recommend you look at workbook because it has more illustrations and flowcharts and tables. So you can get all the content to prepare here within the individual topics, and then check out all the other topics associated in the same workbook byte. Plus, you must also watch the video attached to each of these, right? So when you watch a video, you will also understand how to tackle a lot of questions, especially MCQ videos, and that gives you good practice and lays your foundation. But the main point here to note is that you must do all your bytes first. And now I will tell you how to maximize your preparation with Meritor's app. Now there are 5 things to keep in mind when you start your preparation for any subject at any given point of time. Number 1 is to start with tasks. Like I said, tasks are the building blocks. They are your foundation and fundamental for any subject. You need to start preparing for the task with the workbook. You must look at the video if you have any doubts regarding the topic, and then practice questions. And then you can take the test. Now, whenever you are taking a test or practicing questions, each question comes with the answer, explanation and key concept. The explanation will be elaborate. It will tell you everything that you need to know about the topic. It is a good source of taking down notes because a lot of additional questions can be asked from the existing explanations, right? And if you are well versed with the topic, you can just look at the key concept and reinforce the topic in your mind. Additionally, a lot of questions also come with multiple choice question videos, which are explanatory videos. They are going to talk about how to eliminate options, how to strategically focus on the question, and additional knowledge that comes with the topic. So your first aim should be to complete all these tasks for a given subject and then move on to the next thing, that is Q bank. Now Q bank or question bank is a collection of high yield extensive questions. They are clubbed together in topics, they are clubbed together chapter wise, and you will have more hands-on experience on difficult and extensive preparation on these questions. Again, they will come with explanatory videos, explanations and key concepts. So once your tasks and Q bank for a given subject are complete, you are good to appear for the weekly checkpoint tests. Now the tests are of 2 types in the app. One is the weekly checkpoint test and self-paced test. I'll tell you about the weekly checkpoint test first. So suppose if you are preparing one subject over the week, then at the end of the week you will have a test which is going to focus on that specific subject plus the subjects that were previously prepared, right? So that kind of snowballs the entire revision strategy. You will have a repeated encounter of multiple subjects from time to time. So you do not forget. It's easier to keep these topics in mind when you constantly see them. So the revision is reinforced. Plus you also get personalized AI recommendations, right? So at the end of your test, based on your performance, you will get how many questions you answered, what was the score, how much was the negative marking, where are you lacking, what are your stronger points, and then it will tell you how much time to dedicate for a revision of your weaker subjects. So with this strategy, you will be able to focus on specific areas that are your weaknesses. Now that is an exceptional feature of Meritor's app. And the next set of tests is self-paced test, which you can take at any given point of time. These are subject-wise tests. You can also have cumulative tests, multiple recall questions also incorporated in form of tests. And towards the end of your preparation phase, you will have a lot of volatile, factual, high-yield questions in form of final strokes, which are again specialized tests to be able to remember these topics clearly before the exam. Now, once you come closer towards the end of your preparation, you will have access to this special feature of the app called Marathon. This is activated towards the end of your preparation, where you will have 3,500 plus high yield questions. High yield questions meaning they have the chances to be seen in the exam, because either they are based on recall questions or because they are based on important concepts that are repeatedly seen in the exam. So when you practice these 3,500 plus questions, you will also enter an all India competition where you will get a fair idea as to how your performance is with comparison to your colleagues. It's a great boost of confidence if you take it at the right time. And lastly, we have the all famous national mocks, which is a pan India or all India nationwide simulation of NEET MDS exam. We conduct them towards the end of your preparation in a few months to go. And every weekend you will have access to this special test. You will see a lot of new questions in national mocks which are based on important topics. So do not miss national mocks because it gives you a good hands-on experience of the exam. It gives you an idea of time management because this is exactly according to NEET pattern, that is 240 questions and 3 hours with negative marking. So you kind of get a very fair and square idea of your performance because this is again an all India competitive mock exam, and you will get personalized AI recommendations here as well. Now they are more important for national mocks too because towards the end when you are revising, you will not know which subject to pick up at what time, and your performance in the national mock will be assessed thoroughly and you will get your AI recommendations which will tell you which subjects to revise. So make sure that you are making use of all of these features in the app. Now, apart from that, if there is any query that you have while solving your questions, if you have any doubts regarding any topics, you can always contact the faculty on the WhatsApp group. We are always here to help you. And I hope with this in mind, you will be able to channelize all your preparation strategy in the right direction. And I hope we'll be able to help you achieve your dream seat in MDS. Thank you so much and good luck from Team Meriters.